This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Does a high BMI have an effect on embryo implantation and thus a successful pregnancy?
Yeah, the evidence is fairly convincing. It's not it's not if you're overweight, you won't get pregnant. It's that it probably makes, I quoted a figure at 35, you've got a 35 to 40% chance of an embryo implanting and being a positive pregnancy test. If you're obese, it's probably more 28 to 32%. So it's that 5% difference that obesity may make. How that why hasn't really been defined. There's some evidence that in women who are overweight, the eggs have a different makeup in their fat content inside the egg, their lipid profiles, that may make them less likely to fertilise and less likely to carry on. In terms of once a pregnancy has been proven, miscarriage rates are slightly different, but it's a marginal difference once a pregnancy is properly established. So yes, it does make a difference. So that's why we encourage people to lose weight if possible.
Prof, a question from Kate, live. If you have had your tubes removed due to endometriosis, is further surgical removal of endometriosis beneficial prior to transfer of embryo?
I don't think anyone knows the answer to that question. If in the process of having your tubes removed, your surgeon was a skilled laparoscopic surgeon and they cleaned out the most of the rest of it, then that's the best you're going to get. And I would doubt that going back and doing more surgery is going to make much difference. Having said that, it depends how long ago the surgery was done. Unfortunately, endometriosis is a progressive disease. You can remove as much as you can see, but in 2 or 3 years' time, it may have recurred. If your surgery was significant time ago, more than 3 years ago, perhaps it is worthwhile doing laparoscopy before your next embryo transfer. If the evidence, particularly if there was evidence on ultrasound that there'd been a recurrence of your endometriosis. I think I'm standing on the fence there. If, however, you then went through a cycle and it didn't work without having the surgery, you might think about doing it before the next transfer.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.